I'm Connie Jo Campbell from the VA Medical Center, and I'm going to talk about life after transplant. When reality confronts the way we wish life would be, it is time to reflect, accept, adapt. Seasoned recipients will tell you that adaptation is the key. We're going to talk a little bit about that. Adaptation implies that something has changed. So just because you are going to have some type of transplant or you have an LVAD, if your life hasn't changed already, it will change in some way. It is normal to want your life before you are sick. Depending on the individual's diagnosis, some patients have been sick for many, many years, so they don't remember what it's like to not be sick, and so their norm is being sick. And other patients, it's an acute issue where they had a heart attack or something happened, and so they became ill. And some of you guys in this room have experienced that, some other individuals who are not in the group. So I think that's really important, and sometimes it's hard to get out of the sick role. When you get a transplant, you're no longer going to be sick, and if you've been in that sick role, it's kind of hard to get out of that mode of, I can't do this, I can't do that. So we'll be talking a little bit about that. But just the fact that you've had an organ transplant means you cannot just be the same. I just kind of reviewed that. Satisfaction with life after transplant depends on several factors, but begins with you. We're going to talk about all those different things. Make a commitment and look to the future. One thing that I found, I've been doing transplant for 11 years at the VA with heart transplant, and a lot of my patients haven't looked towards the future because they don't know what that future is going to be, and so they just haven't planned for that future. So I always tell my patients after transplant, if you haven't planned, and even when you're waiting for transplant, you should be planning even if you're waiting for transplant, if you have an LVAD. You know, those things that maybe you want to do. It helps with keeping you motivated, keeping your attitude up. Harris?
Yeah, I experienced that exact thing. When I was going through with the Jarvik 2000 pump, I was always just looking a week ahead. And I was staying depressed all the time. And finally, Jake, over here at the U, he told me, he says, Terry, you gotta look way out. Mm-hmm. And as soon as I start doing that, I start feeling better. Mm-hmm. Good
feedback. Good feedback. Yeah. So even while you're waiting, and then afterwards, you need to plan. What are you going to do? What are you going to do in the next year? 2 years, 3 years, 4 years. You know, you now have that new organ to live your life that you maybe were not able to live because physically you couldn't do it. So plan those things. My patient is aware that I tell this story, but I have a patient who, I bet he's been transplanted maybe 5-6 years ago, maybe more than that. And when I came 11 years ago, he had his LVAD for maybe about 6 months or something like that. He ended up having, this is a time when the LVAD patients did not leave the hospital. You had to stay in the hospital the entire time you had an LVAD. And so he had already been a while and was kind of getting stir crazy, and so the staff was able to get him a computer, and he basically, the 3 West of the VA was his home, and was his home for over a year. So this patient sees the 4 walls of the hospital. How does he cope with that? He got a computer, and he would look on the computer to figure out where he was going to go fishing. Did he ever know he was going to go fishing? He didn't know. You know, hopefully he was going to get the transplant, but who knows? So he had all these ideas of where he was going to go fishing, and that kind of kept him motivated. He now has a home in Colorado. And it's like just a stationary place, so he has a home in the States. But he has a boat, and him and his wife travel all over on a sailboat through the Florida area. If we look back then, he would not have known he would ever be in that situation. But he is living life, and that helped him get through it by doing something. What am I going to do when I get through this? So, that's a very unique situation because you guys who are here can leave the hospital, but he could not. He would escape, though, and went down to the arena at the Great Salt Lake. And we didn't know he was gone, and he would run, and that's kind of, he meant a lot of, that was his support, was down at the arena at the Great Salt Lake. So he would escape every so often. I think the nurses probably knew, we just didn't like say anything, but he kind of escaped, and that's kind of how he was able to live about 1.5 years in the hospital, which is a long time.
Jeez.
So we've changed a lot by patients being able to go home with LVADs. Adaptation requires an integrated, holistic approach to life. What persists? What resists persists. Adaptation is a choice. So I'm saying you need to adapt, but is it a choice? Do you guys all have a choice to adapt?
Yep.
Okay. Everybody's saying yes. You do have that choice, but is that a good choice? No, it's not a good choice. We all have choices. We live in a free country. But as Stanley says, it's really not a choice, because if I don't adapt, I'm not going to be a happy person, and I'm not going to be able to live life. So it's better to just adapt, because you're going to be much happier and be able to do what you can do. But some people, you know, just want to resist. So what to expect? When I'm done with the presentation, I have we have patients that you heard here introduce themselves who are different levels of transplant. So when we're all done with the PowerPoint, we're going to have them talk a little bit about their experience. So I'm going to tell you some general stuff, and they're going to tell you some personal stuff related to that. So mine's going to be general, theirs is going to be more specific as I talk about this. Physical changes. We're going to talk more about that. The prednisone can do different physical changes. Cognitive changes. Sometimes patients, when we give you the high level of prednisone, you don't think as well. That's why we have a caregiver for 6 weeks that is required in all transplants. And that's because we can't trust that you will remember the changes to your drugs, remember your appointments. It's not that you're not smart. It's that we have some drugs on board that affect how you think and organize. So that's why it's so important that you have a caregiver for 6 weeks. Also, you cannot drive for 6 weeks. You cannot be in front of the steering wheel because of your incision. So medication management. The patients, we're going to talk a little bit about that, who have been transplanted. I know the thing that I hear from patients is when they first go home, it's really overwhelming. You don't just get this little bag that you normally get when you go to the doctor's office bag. You get a humongous box, a huge box. I mean, you could put a chair in that box. And then you have to go home and organize those and figure out what are you going to do with this huge amount of medicines. So a lot of people have all different, and hopefully you guys, when we go around, we'll talk about how you organize those meds. Everybody has different ideas on how to organize them. Your immune system is not going to be the same. Gordon and the other ones who talked about, they've been out for a while, their immune system is not as good as mine, but it's better than a patient who's 5 weeks out. But you're always going to have to be cautious of your immune system, being around other people. The flu season, that's a really bad time to be hanging out in the grocery stores, in the theater, those type of things during the flu season. Exercise, some patients have had exercise, the cardiac rehab, and the lung patients have had their pulmonary rehab. So you have that before, you're going to have it afterwards. We need to make sure you're getting strong. With the heart patients, we have to monitor you because you can't feel how your body's reacting because the nerve has been damaged. So you can overwork yourself and not underwork. It's usually overwork, and so we have to monitor that and help you reevaluate when you're getting to your maximum. So patients, and I know that pulmonary, they go to patients who get lungs get pulmonary rehab as well before and after. Time management, diet and exercise. Many of you guys have been on diets before. You have a diet, whatever that diet is. You know, you have to restrict it on salt, this and that. It's going to be the same thing. Remember that this new organ needs to be healthy. And so if you go back to having salt, and even if you didn't have salt, but you think, oh, now I got this new organ, I can do all this stuff, I can eat all this bad stuff. No, you want to preserve that organ and live as long as you can. So it's really important to talk to your medical team about what's the appropriate diet. Time management. Your time is going to be taken away from you. With pulmonary rehab, you're on a really tight schedule before your transplant. It's going to be the same thing, but then you're going to have lots of visits too. So our patients are probably there 4 or 5 days a week for a while, and so you know, you don't like it, that's okay, but you're going to have to deal with it. It's not at that point. It's not a choice whether you come or not. You'll be there, and if you're upset about it, then you'll just be upset the whole time. It's just expected. You need to come to clinic. You need to get blood draws, those type of things. So, and then if there's any changes, we'll talk about this many different times. Inform the transplant team of any changes. If you guys have something that you're not feeling good, you're throwing up, that's much different than me throwing up. Okay, you throwing up your meds, that's a big deal. You need to call your transplant team. You having a little cold is much different than myself, who's healthy, and I don't have a transplant, then cold for you guys can become pneumonia very quickly. So those little things are really important. There's 24-hour coordinators on call at both the hospitals, and so they would much rather get a call from you and say it's no big deal than for you to be admitted to the emergency room. And this has happened where patients thought it was a little thing and it ended up being much bigger. So any kind of changes, little changes, you don't feel right, something like that, you always need to tell your transplant team. We talked a little bit about the cognitive risk of depression, emotions, stress, those kind of, so there's all different ones. Mental effects of anti-rejection medicines. I kind of addressed this, I'm going to go over it just really quickly. It can cause confusion and memory problems. Also, these problems are temporary most of the time. If not, you need to let your doctor know, and the doctor will be following you really closely. Irritable, emotional, restlessness, difficulty with sleep. If you're having some of these, let us know. We can give you something to help you with sleep. Help you if you're really irritable. So that they let you guys just kind of look over that. Prednisone is the one, and I know that the patients who are on our lung transplant have already experienced a lot of these. And the lung transplant who's here, she'll address a little bit of that when at the end. But she's been on that for a long time before, and then was on it is now on it after her transplant. One of the things that's hard as a caregiver is when the patient's really irritable, and the best thing that the social workers we can tell you and the medical team can tell you is, as a caregiver, you need to have a way to get away. Whether it's read, whether it's go for a walk, because your patient isn't going to be nice to you all the time. But it's not the patient's fault. Go ahead.
I think it's important to know, as a pre-transplant patient, to know that these things can happen to you. Mm-hmm. I also think it's important for the caregiver to stress this to the patient. You know, you're a little irritable right now, and it's because of your medication. It'll be okay. Mm-hmm. But I also think attitude is so important. Mm-hmm. In all of this. You know these things are coming, you can get through them, mm-hmm. and looking to the future, you're going to be healthy. You're going to be able to do most everything you did before.
Yeah. Thank you. And just to reinforce with this group is that we have the buddy program. And that's exactly what the buddy program's for. It's for the patient to call and talk to somebody on the buddy program. Or the caregiver to talk and say, you know, this was happening, how do you deal with this? And it just, a lot of times, what the caregiver needs and the patient needs is a listening ear, not someone to say, you know, you should be doing that or something like that. You just need someone to accept that it's okay and, you know, give you maybe some suggestions of maybe what worked for them. Okay? But a lot of times, like she said, it's good to let the patient know, but a lot of times the patient has no idea that they were rude to you as a caregiver. They just don't know. They just are not recognizing that. So if you have a discussion about it and you disagree, it's going to become a huge fight because the patient's not going to see the same area that you see. Some patients are more tearful. I have a patient who had the transplant, a couple of them, and they just cried and cried and cried. And it was very uncomfortable. And these are male patients, not that it's, you know, should matter, but I think in our society, males are taught not to cry at all. And so when my patients and all my patients have always been to the military, and I think that sometimes does make a difference too, you know, that you got to be strong, you're in the military, you got to really, and so they cry and it's something's wrong, this is really horrible, and it's like, no, that's related to your medicines, it's okay, we're here for you, you know, and it's just, it'll just come out, and it's very uncomfortable. So if we just, like you said, normalize it, it's okay, it's related to the medicines. That helps a lot. Disinterest, loss of enjoyment, sometimes that happens. And another one is disorientation, extreme fear, severe agitation, erratic behavior, different things like that. We have I had a patient who was really into shopping, a couple of them. You know? We have a couple patients who, you know, that's what they wanted to do, is shop, 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 shop. Well, they were at a pretty high level of prednisone at that time. You know, that's just what they wanted to do. They were just up all the time, wanted to do things. So some patients are like that. Don't suffer till your transplant doctor, your coordinator, or the social worker. Stress and anxiety, we're going to address that a little bit. What is stress? Stress is when when you're not comfortable and you don't have control. Okay? When we are in comfortable routine, we feel in control. When things go our way, we feel in control. So some of this has already happened before you get the LVAD or before the transplant, because we have taken a lot of control away from you. And we, as a transplant system, will tell you that. We have taken control. And do we have a choice? No, we don't have a choice. We've had to take control. We've had to tell you, you need to relocate here, or you need to be here, or you need to be at these appointments. And I'm sorry that you have this commitment, but you'll have to rechange it. Because this is when we have clinic. We have clinic 2 days a week or 3 days a week, and it's in the morning, and I'm sorry that you have this other thing that you do, but you'll have to change that. So we have already taken a lot of control away from you. So when you're waiting, and after transplant, you need to figure out, and we need to help you come up with some way to have some kind of control. Sometimes the control is, maybe I'm going to have my blood draw, you know, at 7 instead of 6:30. Or maybe I'm going to take my medicines. Everybody takes their medicines at different times. So if we said to everybody, the rule is you have to take your medicines at 7 o'clock and 7 o'clock. Now we could say that as a transplant team, is that right? We could say, we want you to take your meds at 7, and there's no exception. But we don't do that. We let you guys decide. Some patients like take them at 7, some take them at 8, some take them at 9, some take them at 10. The big thing is that you take them within a 12-hour period of time. But we don't say you have to have it that. But that would be really taking control, which we don't want to do. Do you have a choice when you have your procedures done, your bronchoscopies, your biopsies? No, you don't have a choice. It's scheduled, it's theory on, or whatever, of how works best. You know, you have it every week, then you have it every 2 weeks. Are we going to change that? No, we're not going to change that. Can we adjust a little bit when you get farther out? Yeah, we can. We have a patient who wanted to return home for her birthday. And so we adjusted her biopsy by about a week so she could go home for her birthday, and then we adjusted it the next time. But she is 6 months out of transplant. She's not a week out of transplant, 2 weeks out of transplant. So you can always ask, and we can see if we can adjust some of this stuff, but sometimes it's not possible. So if you can find some kind of control and comfort, you're going to be less stressed. But that's going to be with you, your caregiver, and your medical team. The discrepancy between how life works and what we prefer is a root of stress. So sometimes people they just are stressed all the time just because the way they look at life, the way they see things. They don't take it as it goes. As a transplant LVAD patient, you're going to have to kind of roll with the punches. You know, if we say you're going to come in at 7 o'clock and you get your biopsy until 10, 11, or 12, if you're upset about that, you know, that's great, but that's a stress that you've caused on yourself. The bronchoscopies, you're supposed to have it at 9 o'clock. And there's an emergency and they can't do it till 1 o'clock in the afternoon. You can stress about it, but it's just extra stress that's not going to help you. You know, emergencies happen, situations happen. So that's going to happen probably sometime when you're follow-up, but there's nothing we can do as a medical team other than to tell you, do the best you can to reduce your stress and kind of go with the flow. Stanley, did you have a question?
No.
Did you have a question?
No, I just have a comment.
Okay.
One of the things that we kind of realized pretty early on after transplant was just like the Eagles song, California, Hotel California. You leave, but you can never or you check out, but you can never leave. Just
keep on.
You're always here.
You're always here.
Yeah, your transplant center is always your home, and your transplant team are your part of your family, your team, whatever you want to call it. They're always going to be there. So hopefully you get along with your team. If not, you need to make adjustments personally, your personnel yourself, because that team's going to be your team. So stress, dealing with stress, an event of change occurs. You react to what has happened. This can be a negative or positive. And what would be the best way to react? Positive. Negative, what's it going to cause?
Stress.
More stress. Okay. You choose your response, just like I just said. Okay. Okay, some different reactions to stress. That has to be changed. It should say meet with others. You can ignore it. Some people ignore it, and it's okay to ignore it. If it's not a big thing, just let it roll, you know, roll away. Otherwise, you ignore it, and it can be a big issue. So it depends on that type of stress. refuse to think about it, similar to ignore. People use drugs and alcohol to deal with stress. They smoke, they blame, it's not my fault, it's their fault, it's da-da-da-da-da. That's not going to help get off. Anger, joking humor is really important with dealing with this whole process. I know you guys in here know that that's humor. Humor makes a big difference. It helps you kind of roll with what's happening. Take a break. Important to take a break for the patient, the recipient, and the LVAD patient, as well as the caregiver. Take those breaks. Maybe you need to just leave for a short time. Some of the patients in this room have heard this story, but I had a patient who was an LVAD patient, and LVAD patients, for the first part, cannot be left alone. And so this family was from out of state. There was no other family. And they were living in an apartment. And so the way she got away was she went out on the porch, shut the door, and he wasn't strong enough to open the sliding glass door. That was an escape for her, and it was really helpful to her. And so he just had, and she made sure he's safe before she left. But that's how she got away, because she could not leave. And this was when we had an older LVAD that you had to have a caregiver 24 hours a day. They could not leave. So that was the way that she coped with it, and it worked for her. People would say, what was going on? But she had to have that break away and just have her peace and quiet. Exercise, worry, avoid others, isolate. Is that a good one? Avoid, isolate?
No,
what does that cause?
Depression.
Okay, and depression, it just kind of gets in deeper. Okay.
You talk yourself into things.
Yes.
Yeah. Okay, good. Avoid someone else, hope someone else will fix it. Is that a good thing? No, we need to be responsible.
Yeah.
Okay, believe you are being punished. Is anybody punishing us? No. We made this choice. You guys made this choice. You had a choice to not do this. Was that a good choice? Everybody has their own opinion, but you made a choice to proceed in the transplant process. So, best response is to stress. Need to problem solve it. Figure out if you can change it. If it just has to roll. If you can get help with it. Look after yourself. Take care of yourself. That help reduce stress. People who don't get a lot of sleep, don't get nutrition, don't take breaks. You're going to be more stressful. Our body, if we don't get rid of the stress some way, communicating physically, it's going to build in us and then it affects us physically. Adapt. Sometimes you have to adapt. You can't get rid of that stress. You just have to deal with it. These are just different techniques. Identify it, watch your guide exercise, relaxation, self-hypnosis, someone to confide in, meditation, guided imagery. So just and reading humorous material. Those different ways to deal with biofeedback. Okay? Sex and intimacy. Arousal is something that occurs when you feel an ease with one another. Predictions of quality of life. Consistent medication compliance. This is going to change how your quality of life is going to be. If you put a whole bunch of transplant patients in the room at the same time, do you guys think they're all going to be doing the same thing? Mm-hmm. Okay? No, you're right. No. Depending on the age of the patient and depending on their situation, some patients are going to go back to work. Some patients have already retired. Some patients are in a retirement mode. Some are going to volunteer. Some are not going to do anything. They just don't want to do anything, and so they're just sitting in the four walls of their house. So even though we've all had the transplant, the goal is to go out and live, to take care of this organ, this gift that's been given to you. You put a whole group in, they're not going to be the same. We have a patient who was quite a ways out. It might have been 6 or more years out. And he just decided one day that he wasn't going to take his medicines. So his wife kept saying, you really need to take those. And so he wasn't doing as well and was getting sicker. And he said, we really need to go to the VA. And he lived about 5-6 hours away. She kept saying, we need to go, we need to go. No. Finally, he decided to go. We brought him up to the VA and put him in the MICU, and he did not last. Why did he not last? Because his body rejected. He did not tend to take the anti-rejection medicines. Was that something that could be avoided? Yes. Yes, it was. He could have avoided that. And that sounds weird because you guys are new out. But sometimes that happens where patients will say, I'm just tired of this medicine. This is my organ. It's my organ. It's never going to be yours. No matter what you hear in the internet, it's never going to be your organ. It is a foreign body, and you will always have to have some type of transplant medicines. Now, if there's some new technology out there, there's a shot, there's some new technology coming out that you might be able to have a shot, an infusion every so often, but you'll always, at least at this point, have to have the medicines. We have patients at the VA who are way over 20 years out. We do here at the university and the VA in our cardiac transplant program. It was about 2 years ago, I think, we did a 25th anniversary of heart transplant. And there were patients out there. We had a gentleman who was 20 years out, and I think his transplant was 19, I think it was 19, doing great. So the success rate, if patients do really well, now there's always those exceptions that you didn't cause for you to have some complications. But for the best result of your life is going to be that you are compliant with what the team tells you, your medications, your vital signs, it's kind of preventing yourself from getting really sick, those kind of things. Okay? Early intervention when psychological symptoms appear, that's going to make a difference. If you're really depressed, you're really down, need to get help, that's going to affect you. It's going to affect whether you're up, moving, doing your exercises, having your diet, all those kind of things. Stress management, dealing with stress. Like I said, stress affects us. You guys aren't going to be avoided because you have a new heart. But if you get stressed, it's not going to affect your whole body, and tense, and all that kind of thing. And then older age. So those are. It's important to follow all of the different the guidelines of what's being said to you. Sometimes you might say, why do I have to take my weight every time? Why do I have to take my blood pressure? It's the same. Those one changes can make a difference on that we can anticipate you're getting an infection, and then we can treat that before it gets a full-blown situation for you. Patients report a consistent improvement in quality of life, satisfaction after transplant. This is just an evaluation that my student did regarding a lot of different things. We're going to go over the forms that are in front of you guys just a little bit. One of the forms you don't have, and I'll get copies for you guys, is rejection. Rejection is kind of a word that is a negative word. You guys think, oh my gosh, my organ's being rejected. Your organ's not being rejected. It's that the medicines, we need to make sure that it's a balancing act. You guys have been to the medication one. It's either we're going to get your immune system super, super low, so you're going to be more susceptible to infections, or we're going to not do it, and then we're not going to give enough for the organ to be able to be maintained. So it's always a real balancing act. Rejection just means that there's something that came through on your bronchostomy or your biopsy that says that we need to adjust your medicines. Sometimes the rejection is really minor. We just have to change your medicines a little bit. Sometimes it's a little bit more, and we have to bring you into the hospital and give you a little bit of IV. Not a big deal, But that's why it's so important to report when you're having symptoms. We have patients who will come in and they're sick. They think, oh my gosh, I'm going to have to check. You're going to have to do my medicines. My biopsy's probably going to come back not as good. And they're really healthy. We have other patients who come in and they think they're really healthy. There was a patient from the university years ago who went down to California on vacation with his family, came back for his normal follow-up, and he was in rejection. No signs or symptoms of rejection. No fever, no nothing. He's feeling great. So that's why some patients are like, why do I have to have this biopsy? It hurts. The pain in the butt, the bronchostomies are not fun. It's because that's how we determine that. With the liver transplants, they go only by blood tests. They don't have biopsies. So they have to watch their blood tests just like with you guys, but that's how they determine whether they're having any type of rejection. So this little paper will tell you about the fevers, those type of things. And like I said, anytime you have changes, you want to make sure your transplant team is really aware of any of those little changes. A fever to you guys after transplant is not 103. A fever might be 101 or something like that. And you need to talk to your transplant team to figure out what a fever is. Because a fever to you is not a fever the same as me. If you get to a fever like I am, then you're much sicker. So you need to kind of talk to your teams about what a fever is in your particular situation. Because it's not the same as before your transplant. Some important parts I want to talk about of what you need to do after transplant. It's required by all transplants that you see a dermatologist once a year. That's really important because of the the anti-rejection medicines. You're at higher risk for cancer, and you're higher risk, one of the highest risks is the skin cancer. So it's really important that you see a dermatologist, that you wear the sunscreen, you wear hats, you wear long sleeves when you're outside longer term, because you might not realize it, but we have had patients who have had the skin cancer. At least I have, I know the university has. So it's really important. You can't over it. Even in cloudy days, you can still get, the sun still gets through your windows, still gets through. For cloudy days, you still need to be wearing sunscreen. There are some kind of different ideas on that sunscreen, but what I have been told by the dermatologist is that the higher dose lasts a little bit longer. If you apply the 30 like it's supposed to, it's probably just as good. But we don't apply the sunscreen every 2 hours. Most people put it on, they go to the beach, and they don't put it on again. But if you're applying it, but there is a little bit of difference in the intensity of the higher the sunscreen, and that's from a dermatologist. Other people have different opinions, but I've asked the dermatologist about that. The other thing is you need to see the dentist. They say that one of the dirtiest part of our bodies is our mouth. And so there's all kinds of stuff that can grow in your mouth. And so you need to see a dentist on a regular basis so that they can make sure that everything's being taken care of. Unless this has changed, and you know things change all the time, so you need to talk to your transplant team. You need to have an antibiotic before you have any cleaning or anything. Because when you clean your teeth, it bleeds, that gets into your body. So if you don't, you can get an infection just from a cleaning. So you need to talk to your transplant team on if you need to have an antibiotic. Like I said, as far as I know, patients still do have to have antibiotics for any type of dental care. So those are two really important follow-up appointments to be aware of. Your transplant team is available even when you go home. A lot of you guys are from out of the area. If you go home, they're available to you. There's always someone 24 hours a day. So if you come to clinic and say, I couldn't get a hold of somebody, your transplant team's not going to be very happy because there's someone on call 24 hours a day in all of the transplant areas. So 2 o'clock in the morning, you're feeling bad. You say, oh, I really don't want to call that person. I want to wake them up. What they're there for, you're going to wake them up. They'd rather have you call than to have you in the emergency room in a difficult situation. A couple things regarding medications. It's really important that you talk to your transplant team about what medications you can take over the counter. There are a lot of over-the-counter medicines that you took before your transplant that you cannot have now. You cannot have aspirin. You cannot have Advil. Anything with aspirin in it. Those kind of things. There's a lot of cough medicines that you can't have. There's a lot of the dryness. What's that stuff called, you guys?
Nasal drip?
Yeah, the nasals, all that kind of stuff. The stuff that dries your nasals out. Some you can't have those. And so you need to talk to them about what medications you can have. You should not be running to the grocery store and buying something unless you've checked it out with your transplant team. There are ones they can give you that can work, maybe not as well, but it would be much better for your transplant. So look through your cupboards, bring them to clinic, ask them if you can have this. If you can't, get rid of it. Because it's not worth. There have been patients who have gone to their primary care doctor and have not called the transplant team, and then been given an antibiotic and they've ended up in the ER and admitted because they were given the wrong antibiotic. An antibiotic is not an antibiotic, and there are certain ones you guys should have and certain ones you shouldn't have.
In some of the meds that we get, they're immune suppressants, right?
Yeah, there's 3.
So if you see something on TV that says, or you're reading it in the drugstore saying it will build your immune system better, don't take that.
Don't take that. Exactly. Yeah. Can you repeat that again?
What I said, just said?
Yes.
I said if I'm taking the immune suppressant medicines, if I go into the store and see over-the-counter meds that say build your immune system back up, don't take those, correct?
Yes. So what Terrence is saying is that you should not take. He's wondering, should you take any medications that are over the counter that are help your immune system? You should not take them. Those are medications that you should not take, and you should not take any kind of herbs other than the cooking herbs. You can have cooking herbs, but you can't have herbs in a bottle. The reason you can't have herbs in a bottle is because the bottles are not regulated. If I have a pill here, I take a couple pills out, those pills are not going to be equal amount of herbs in them, and what they do is they increase your medication, which reduces your immune system even more. So herbs are out, Herb teas, if you like herb teas, you need to talk to your transplant team, bring in your tea package. They'll look at it, the pharmacist, and tell you whether you can have it or not. There are ones you can have, like green tea, but anything added, they'll let you know. Also, the power drinks, you need to have them look at that because that has a lot, like you said, to build your immune system, and that's probably not in your best interest. But it's the best thing for me to tell you is to talk to the pharmacist. University pharmacists are experts. That's what they do every day, and they can tell you whether it's going to affect you or not. If it's something they don't know, they'll do a lot of research on it because there's new things coming out all the time. But you don't want to take the soapy drinks, health drinks, the
Red Bulls.
Jamba Juice, the Red Bulls, no, definitely not the Jamba Juices. They put grass in it and all those kind of good things. St. John's wort, those are herbs. Those you should not have those, so you need to be looking at the titles. Another thing is that's new is flaxseed. And if you look at the stuff, granola, a lot of breads, flaxseed also affects you as well. Okay? Pomegranate and grapefruit juice, same things. Not oranges, just pomegranate, the juice, the fruit, and then grapefruit, the juice, and the fruit. Those also affect. So those are ones you need to really stay away from. You know, other things are really helping. So when you travel, what do you do with your medications?
Take them with you.
Where do you put them when you go on the plane?
With you.
You put them under the...
No.
Put them up above. Okay. You don't ever want, when you go on the plane, your medications are in the plane with you. They do not go in your luggage. Okay. When you're traveling in the car, you need to make sure that you're not leaving your medications in a hot car because your medications, some of the transplant medications are susceptible to cold and heat. If they get into that, they will not be effective.
And sunlight.
Yeah, and sunlight. And I do have a patient who had this. He was traveling, had left them in there, didn't realize it, and it was a liver transplant. It took quite a while for the transplant team to realize why his labs were not good, and it was because they realized that his medications were not where they, were damaged because of the heat. So it's important to make sure that they're not overly heated or cold, some of those medications. Okay? You want to take more than, if you're going on a 1-week trip, you don't want to take a 1-week trip, you want to take 3 or 4 weeks. You don't know what the travel's going to be like, even if you're flying. You know, something happens in the Midwest and you can't get back here. You're not just going to run to the local grocery store and say, I need my 3 transplant medications. Sometimes they don't have them. Trying to get an out-of-state prescription is really, really difficult. So make sure you're taking many amounts. A lot of the patients just going to run errands. When you leave your house, patients will take their night medicines as well as they'll take an extra day. Patients sometimes will order the fanny packs. And then they'll just have an extra set of medicines in there, just because you don't really know, what's going to happen in your day. Especially I think more in the winter, but with construction, you never know when they're going to block a road and it's going to take you longer to get somewhere. Okay? So third world countries, because you can't have live immunizations, you can travel everywhere across the world except for the third world countries. And that's because those are live and those will affect you guys. So other than that, you can travel. The other thing people ask is, what about immunizations? You need to talk to your transplant team. We had the N1H1 last year, and our transplant patients, we did want them to get it. It was better to get the shot than for them to get that. But it'll just depend on what the shot is. This year it was 2 different shots. You just need to ask your transplant team, pneumonia shots, all those. You need to ask them on whether you get it. It depends on how long you're out, what your organ is, those type of things. Okay?